Hey guys, I'm live. I'm so sorry YouTube wasn't letting me go live for whatever reason. I never have a problem with it, but today I had a problem with it. So we're going to have to come back to Instagram today. I apologize. I know you guys like the YouTube live, but I tried everything. I tried restarting my computer. I tried every single thing I could think about, and YouTube just wouldn't let me go live. So I'm going to give you guys our disclaimer just to remind you, this is for education and inspiration only. I'm not a doctor, nor do I want to be a doctor. The stuff we're talking about is not for treating disease or preventing disease or diagnosing disease or prescribing anything for disease. It's really just talking about our bodies, learning to understand our bodies a little bit more. And then I hope that you will take what you're struggling with or whatever is going on in your body and apply whatever we talk about today and do your own research. And maybe this can just kind of be a springboard for your own research and what your body needs. So that's hopefully what you guys do today. So that's our disclaimer for today. And then I kind of wanted to do like a product highlight right now just to let people join, and hopefully the people that are waiting for me on YouTube are realizing I'm not going to go live on YouTube and I'm coming back over to Instagram. But this is activated charcoal, and this is kind of one of those it gets worse before it gets better supplements that I really like to highlight because activated charcoal is a binder. And so when we are shifting our hormones and we're changing things and we're speeding up our metabolism, right? We start to eat more frequently, we start to support our metabolism, we start to support blood sugar. We're going to start making more progesterone. We're going to start having better thyroid function because now our liver is converting T4 into T3. And so we're going to start moving estrogen, right? We're going to start probably seeing some estrogen increased symptoms, whether that's lethargy or mood swings or depression or anxiety, or just our moods are all over the place, maybe headaches or things like that, maybe just feeling off. And that's going to especially be concentrated around the times when our estrogen will normally rise, which is right before ovulation and right during the middle of the luteal phase. So the luteal phase tends to be really rough for people who are moving estrogen. And so activated charcoal, what it does is when you take a big dose on an empty stomach, away from all supplements and other medications, because it binds to everything, it can help kind of bind to the toxins that are in the digestive tract, these toxins called endotoxins. And it helps kind of lower just burden all over the body, endotoxin burden, but it can also help with serotonin issues and estrogen issues because estrogen is going to be serotogenic, which means it's driving serotonin, which is going to cause all types of mood issues. So that's just something to kind of remember. If we are moving estrogen or our junk's kind of changing in our digestive system, activated charcoal can be a really useful tool to take maybe once or twice a week to kind of bind to all of those problem things that are coming out of our bile. Hi, I love your page, but I'm having trouble narrowing down specific foods for my hypothyroidism that you suggest. Thank you. This is why I created my online program, Fully Nourished. Fully Nourished is all about a metabolic style of eating. I teach you guys how to combine protein and carbs. I teach you, how to use mostly roots and fruits for carbohydrates and use those high quality animal proteins. And Fully Nourished is currently getting renovated, and so that's really exciting because the content is just going to be expanded upon and made better over the coming months. But that's really because if I just told you to eat XYZ, it wouldn't help you. You need to know why you're eating what you're eating, and you need to know how to eat properly, how to eat frequently enough, how to balance your blood sugar, how to listen to cravings, how to understand what cravings mean, how to combine foods and figure out how they work for your body, how to track temperatures and pulses. So those are all factors, and if I just told you like, oh, you need to eat this, it wouldn't really help you. You wouldn't really learn about your food and gain knowledge and confidence around your food, and it's really important to know why you're eating what you're eating. Are mouth ulcers a sign of deficiency or general inflammation? If it were to be my guess, and this is just a guess or speculation, I would guess maybe some imbalances within the digestive tract and the microbiome. Remember, we have this balance of bacteria that goes all the way throughout our digestive tract, including our mouth. And so I would guess that there's possibility of an imbalance in the bacteria in the mouth. And then I would also explore oral infections, like if you've ever gotten a root canal or your wisdom teeth removed. Those are things that can cause underlying infections underneath the gums, near the bone, that can also drive issues if nothing else is working. My boron levels are non-existent on my HTMA. NA, should I hold off on taking magnesium until levels are up? Brand of boron that you like? Did you test boron? You have to add it on if you're using like trace elements. And so oftentimes if you don't add boron on for $7 and actually write on your requisition form, like add boron, they won't test for boron. And so it will say NA, not applicable. So that's usually why you get the NA result on your HTMA. And even if boron levels are really low, a lot of times it's like 0.00001 or something like that. So I would say NA, like that is particularly low, or you didn't test for boron. What kind of breath work do you usually do? I actually follow the Mitigate Stress, their free guide. They have like an amazing $99 course that talks about like trigger point therapy and breathing, but they also have this free guide on their website that's an incredible resource as well. So they talk a lot about proper alignment, proper spinal alignment, doing trigger point therapy, and then also doing proper breathing. And I follow what their teaching is. It's very, very helpful. But I also do something called 4-7-8 breathing, which is breathe in for 4 seconds. So you take a deep diaphragmatic breath and then you hold for 7 and then you exhale for 8 seconds. And so whenever you're holding your breath, your body has a very difficult time being in the fight or flight state. It tries to relax, right? So if you're breathing in for 4, you're holding for 7, and then you're exhaling for 8, it switches you from this sympathetic nervous system state where you're in this constant fight or flight state, trying to eat your tissues, into this rest and digest state where you're relaxed, your cortisol levels are down, you're making more progesterone. So that's a breathing tool that I use throughout my day. When I'm feeling really, really stressed, I'll sit there for maybe 10 minutes, set my timer for 10 minutes, and just practice 4-7-8 breathing. Is there an optimal transit time? If so, what is it? I think that an optimal transit time is around 24 hours or maybe even a little less. Of course, we don't want to have diarrhea or loose stools, but we definitely don't want food sitting there for 48, 72 hours. And so a lot of people think that they're not constipated, but then it's taking food like 72 hours to get through their digestive tract. And I'm like, that's still kind of constipation in the sense of like slow bowel movement, slow transit time. And so that's still causing an opportunity for bacteria to overgrow, bacteria and funguses to ferment. That is creating opportunity for these pathogens to create more endotoxin, to eat the fibers that we are eating and to consume them, and to create these lipopolysaccharides that are so inflammatory, that cause blood sugar havoc and cause all types of like autoimmune symptoms. So we really want to make sure that we're getting our transit time up. And part of the way that we do that is by speeding up our metabolism, eating metabolism supporting foods, getting our stress levels low, getting our thyroid function up, helping our liver out. So everything that I talk about here, that's the basis of my teachings. I'm always keeping those things in mind. I'm teaching you guys how to heal in the sense of like, you don't have to worry about transit time. You're working on your metabolism so you can get your transit time up. You'll see that as kind of like a benefit of working on your metabolism. You don't have to worry about like, I need to speed up my transit time. Like that's something that you can't really speed up until you get your minerals balanced, with like magnesium and potassium, and get yourself eating things that are not going to slow everything down. Is decaf coffee just as good as regular coffee for blocking iron absorption? I would say yes. I think that iron absorption is mostly like the tannins involved. Don't quote me on that. I could be wrong, but I do believe that decaf coffee would be just as effective. The only thing different is the lack of caffeine. But be careful what type of decaf coffee you're consuming. If it's chemically decaffeinated, it's not a good idea. It should be Swiss water processed. Hey Jess, hope you're having a great week. Thank you, Rachel. I was hoping you could explain why we all have iron overload. Why are people told they are anemic? Thanks. Yeah, it's super confusing because a lot of us are being told we're anemic. But remember, they're using ferritin levels, and the people that discovered, I cannot recall the scientist's name off the top of my head, but the people that discovered ferritin, which is a storage form of iron, they kind of made this discovery of ferritin, and they started pushing testing in that direction. And then like 3 years later, they were like, oh, oops, ferritin's not actually a good measure of iron stores. But the way that the medical system works is once it catches on, it's very hard to stop the chain reaction. And so people to this day are still testing ferritin as a measure of iron, whereas like that is not a good measure of iron at all, iron levels within the body. We want to test all of iron saturation. So oftentimes, anemia is just being diagnosed based on ferritin levels, which is just kind of a horrible way to test iron anyways. But if it's truly like iron, you are testing a full iron panel, full Monty iron, you're seeing all of those issues, it's usually a magnesium deficiency or a copper issue, and very rarely actually an iron issue. But Morley Robbins, he's like the mineral king. His whole life's work is about this. So for people who are like, I've been told I'm anemic my whole life, check out the works of Morley Robbins, because he talks a lot about like iron issues, iron toxicity, and why copper is actually the problem and magnesium is actually the problem. So that's something to check out. But when it comes to iron overload, we all grew up, and unless you were like eating home cooked meals, you were staying away from fortified foods like cereals and breads and Chips Ahoy and stuff like that, you were getting, a lot more than what you needed. We only need, I believe, 1 milligram of iron. I think it's 1 or 2 milligrams of iron per day. And many of us were eating, in one serving size of Cheerios, there's I want to say a couple dozen milligrams, but don't quote me on that. It could be maybe like 10, but I think it might be upwards of like 40 milligrams. So, and most of us weren't like just having the serving size of Cheerios or shredded wheat or something like that. So we were getting all of this iron, which is non-bioavailable. It's literally iron shavings. And then if you ate fortified flour, meaning like all white flour is fortified with iron, these iron shavings. And so we grew up eating all of this iron without needing that much iron. And what happened is, of course, our tissues are going to store it. The liver can only has so much capacity to hold iron. We need iron in the liver for sure, but we don't need that much. We need iron in the kidneys for sure, but we don't need that much. And so sometimes it needs somewhere else to go, and it often will store up in the tissues. Keep in mind that iron also has a synergistic effect with estrogen and copper. So estrogen likes to bind up iron and copper in the tissues and vice versa. And so an iron issue or a copper issue can cause an estrogen issue. So iron and estrogen are kind of interrelated, and they both store up in the tissues when the body cannot detoxify them properly or doesn't have like enough vitamin C, for example, or bioavailable copper to utilize that iron properly. So I would say we're all mostly iron toxic, and we should be working to better utilize the iron that's stored up in our tissues and focusing on the root causes like magnesium and copper and things like that. What are healthy temperatures during the two phases of our cycle? I'm getting to 98 during the luteal, but stay in the lower 97s during follicular and normal. I wouldn't say it's normal, but it's common. So keep in mind that once we start making progesterone after ovulation, our temps would rise about a whole degree, 0.6 degrees to a whole degree. And that's normal because progesterone is thyroid stimulating, right? It's metabolism stimulating. This is why we tend to be more hungry during our luteal phase. We need more fuel during our luteal phase, because luteal phase is like a pre-pregnancy prep phase, Our bodies, there was a potentially fertilized egg, and so we're preparing for a possible implantation in the upcoming 2 weeks. So in our follicular phase, when we start our period, that's usually our lowest temp and pulse, and that's a more clear picture of where our metabolism is at. So if we have low temps and pulses during our menstrual period, then that is what we need to be working on. We should see higher temps after we start making progesterone. Hi Jessica, can gut healing occur while drinking dairy? Thanks. Personally, I only was able to really help my gut once I started consuming dairy again. This is because of the fat-soluble vitamins, and personally, I consume raw dairy, which was very helpful because of the enzymes and the the fats that have not been denatured. They're completely in their natural form. Keep in mind that dairy is the first thing that all newborns and infants are fed. It's the perfect food, right? Why would nature provide this food for children born with a sterile digestive tract that are very, very sensitive to things like pathogens? Well, because dairy is very protective. It helps seed and feed the gut. So it has these little prebiotics, these little gut feeding fibers that help, or really saccharides, sugars, that feed the bacteria in these babies' digestive tract to help cultivate a proper microbiome. Keep in mind that it only feeds certain bacteria, doesn't feed all, because a baby's microbiome is super sterile and sensitive to overgrowth. And it also has a compound in it called lactoferrin, which binds to iron. We just talked about how iron can be really toxic. Well, lactoferrin binds to iron because what feeds pathogens, what feeds viruses, what feeds bacteria? Iron. So breast milk and milk is fed to babies to cultivate a strong and healthy microbiome for the rest of their lives. And it has those nutrients in it. That's why it's a whole food. It's both protein, carb, and fat, because it's very, very, I would say it's perfect food. Hi, what are your thoughts on choline and inositol for hair health? Inositol, maybe. It is just sugar alcohol. It's in the B vitamin family. It can be helpful for people who are deficient. It can also kind of like restructure the microbiome for people that, for some people. I'm not a big fan of choline. I mean, of course, we get choline from things like egg yolks, and that's super powerful, but I wouldn't personally supplement with choline. Does it matter if choline is derived from soy lecithin? Would it still affect estrogen levels versus taking straight lecithin? I'm, again, not a fan of choline. I used to use sunflower lecithin in my protocols, but now I know kind of like choline to me is not something that I want to be supplementing. I definitely want to be getting it from my food, but I don't really want to be supplementing choline. And my question would be like, why are you supplementing choline? If it's for estrogen detoxification, I like vitamin E personally better, and focusing on the protein, because we need amino acids to get through phase 2 estrogen detoxification, and then we need minerals like magnesium, selenium, iodine, zinc, and then antioxidant vitamins like vitamin C and vitamin E to get through phase 1. So those are the nutrients I really focus on, and the nutrition that I really focus on has a lot of those nutrients, and oftentimes estrogen detoxification becomes a lot more efficient and a lot better. How long should we wait after eating to take activated charcoal? Usually like 2 hours, so I would like keep it 2 hours away, 2 hours before and 2 hours behind. Does activated charcoal bind to iron? Should I consume it with my iron-rich foods? I personally do not consume activated charcoal with food because it's going to bind to all nutrients, all minerals, everything, bile salts. It's going to affect digestion. Unless I like eat a food that makes me feel disgusting, like maybe after I eat at a restaurant and I'm like, oh, that just did not sit well, then of course I'll eat activated charcoal. I don't want to absorb the nutrients from that food. But if I am like eating a high quality meal, I don't want to be taking activated charcoal and binding to all my nutrients. So I personally take it on an empty stomach. Like either I'll take it really late at night right before I go to bed, or I'll take it like right when I wake up in the morning, and I sometimes like go back to sleep, and then I'll eat like an hour or two later. Which brand of activated charcoal do you recommend? This is the one I personally use. It's the best one I've found so far. Is an activated coconut shell charcoal. Some activated charcoals are made from like burnt wood and stuff, which I'm like, not about it. So this one's Solar Ray. This is the best one I've found so far. And I like the powder personally because I can take as much or as little as I want. The capsules, sometimes I'm like, oh gosh, I gotta take a handful of these. So I like the powder better. I'm dabbling with oregano with SIBO, along with, of course, metabolic foods that are most important. How long should I use oregano for? I don't want to go too long. I personally think, you might want to double check with this, but I think that oregano is designed to be healthy for long-term use. It's not synthetic. Like the thing with a lot of oregano oils is they're genetically modified, or they're grown in a greenhouse, or they're grown improperly. They're grown kind of synthetically, and so they have some toxic compounds that can build up over time. And so the thing about oregano is it's wild oregano, and so it has a high amount of P7-3, and it's almost like a totally different oregano from those oreganos that are cultivated and kind of synthetically grown. So personally, I usually will take oregano from like December until April. If I have any like digestive distress or anything like that, but I think it's really powerful. I took it for like 6 months when I had some bacterial overgrowth, and I did okay with it. But again, that's what I did personally, so do your own research. Can insulin sensitivity be controlled or resolved? Personally, I had the worst insulin resistance until I started implementing carbs and stopped eating polyunsaturated fats and tons of nuts and seeds, and started eating way more balanced, way more protein, way more carbohydrates, and got my gut fixed and my minerals fixed because I was super magnesium deficient, super potassium deficient. So I do think it can be resolved. I've seen it with tons of clients. I've seen it with myself. It's just simply a breakdown of how the cell's uptaking glucose. And of course, it can be shifted and changed. So I personally think it can definitely it be worked on. Is it possible that the 5A pathway can metabolize progesterone? Progesterone levels are rock bottom, PCOS. Last time I tried progesterone increased androgenic symptoms. Keep in mind, guys, that androgenic symptoms are actually estrogenic symptoms. So, people with PCOS, and this is where I think a lot of people have it wrong. Like, literally everyone says that, like, this is androgen-based condition. And I have yet to hear more than 2 people talk about how it's possibly an estrogen-driven condition. Remember, guys, estrogen can be aromatized or turned into androgens. It can be turned into testosterone. And if the body knows that estrogen is a very damaging hormone, right? In high amounts, out of context, it is a hormone of growth. Think about that. A hormone of growth. That is scary because it causes the cells to grow in a way that they're not supposed to. It can cause inflammation. It can cause stress. So the body's really smart, right? It's not stupid. It's not like, oh, my testosterone's high, like, oops. It knows that estrogen is a more powerful and more dangerous hormone than testosterone. And so what is it doing? It is aromatizing. It is aromatizing. And so what I find is a lot of women with PCOS, they think they have normal estrogen or low estrogen, and their androgens are a little bit higher. And so just because you have high androgens does not mean your issues are being driven by high androgens. What if that's an effect of what's actually going on? What if that's a protective mechanism? Because why have I worked with hundreds of women with PCOS and only some of them have high androgens, but they all have androgenic symptoms? I would love these practitioners who say that PCOS is an androgen-driven condition. Tell me why that is. If it's an androgen-driven condition, why does somebody have androgenic symptoms and not have high androgens? No high DHEA, no high DHEAS, no high testosterone, no high free testosterone, sex hormone binding globulins, fine. What's going on? Oh, we got estrogen in the tissues, hidden in the tissues, because we've got low thyroid function and low progesterone. 2 things that are needed to detoxify estrogen from the tissues. And so the minute that we get our progesterone levels up, the minute that we get our metabolic function up, remember, the thyroid is the 3rd ovary, according to many scientists, that's the minute that you start to get a flood of estrogen issues, a flood of estrogen-driven symptoms that people are blaming on androgen issues. Oily scalp, estrogen. Acne, estrogen. Hair loss, estrogen. Heavy periods, estrogen. Clots, estrogen. Headaches, estrogen. Anxiety, mood swings, estrogen. We can go on and on and on. Weight gain, estrogen. That's what farmers feed cows to make them fat and ready to slaughter. Think about it that way. Like, they're literally feeding cows tons of estrogen to make them fat. So keep that in mind. So I personally do not think that we should be even concerned 1 iota with androgens, and we should be more focused on blood sugar balancing, which is going to help the hyperinsulinemia and lower those androgens, right? It's just a blood sugar issue. It's a stress issue. Our body turns estrogen into testosterone when we're super stressed out. And then we also really need to be focused on getting progesterone levels up, getting ovulating regularly, and getting that thyroid function up. I cannot stress this enough. We need that thyroid function up. And it's not just about having normal labs. It's about having a high body temperature, 97.8 to 98.6, getting your potassium levels normalized so that your cells can respond to thyroid hormone, and getting your liver full of sugar so that it can convert inactive thyroid hormone T4 into T3. That is the goals with PCOS. Testosterone almost always normalizes itself. Testosterone is going to normalize once we normalize estrogen, progesterone, and thyroid and get stress levels down. I've seen it again and again and again, dozens of times. That's my strategy. I don't even really focus on androgens at all, because if we start shoving androgens down, and the body's increasing androgens for a reason, it's doing that to protect us, so I think the body's wise, and I let the body take the lead, and I kind of pay attention to what the body's saying, what the body's doing, and I always ask, why is it high? It's not how to get it down, it's always, why is it high? Sorry, that was a long rant, but it's just something that is so prevalent, and I just want to break that cycle. What do you think about encapsulating the placenta? Would you do it, or is it not needed? I'm definitely going to do it. The reason why is, remember, the placenta is what makes you progesterone your whole pregnancy. And so what is it super rich in? Nutrients, right? Remember, your corpus luteum during your ovulation. So you ovulate, you drop that egg, and then the emptied egg sac becomes this this gland called the corpus luteum. The corpus luteum starts making you progesterone during your luteal phase. If that egg got fertilized, that corpus luteum turns into the placenta, which therefore makes you progesterone. Your whole pregnancy is super rich in nutrients and provides your baby with a lot of like stored nutrients as well. So I would definitely eat it personally, because you know how we kind of can get some postpartum after we give birth. A lot of people will consume progesterone post-birth and or placenta post-birth, excuse me, and it helps kind of make them feel a lot more stable. And I think it's because of the progesterone levels in that placenta. It's a progesterone producing gland. Best ways to lower estrogen. I have been reading that fibrosis is often caused by excess estrogen. My whole mini course, Mend Your Menstrual Cycle, is actually designed to help women boost their cycle, give themselves nutrients to help their body start to move estrogen in a natural way. I don't like this kind of like mentality, like I need to detox estrogen. There's a reason why our body is not detoxifying estrogen efficiently, and we need to get to the why rather than say how. And so I think that it has to do a lot with nutrition. We need to be balancing blood sugar, filling the liver with glucose. We need to provide our body plenty of protein. We need to be providing our body with the minerals like magnesium and potassium and sodium. And we definitely need to be like eating within 30 minutes of waking, getting enough sunlight, not over exercising, eating enough calories, that type of thing. But yeah, my mini course, Mend Your Menstrual Cycle, goes into that. Hi, Jessica. How are you doing? I'm doing good. Thank you for asking. It's been a kind of a stressful week, like for sure. But it's been good. I love my lives. Can biotin deficiency affect MMA levels? Yeah, I mean, B vitamins in general are kind of like these metabolic keystones. If we are deficient in B vitamins, we're going to see all of our cells function off. And when it comes to MMA or any other hormones, really, it really, hormones are just chemical messengers. That's all they are. It's the cells communicating to one another. If our hormones are off, our cells are screaming at us. And that's what we need to start to see hormones as. It's not about like, how do I balance my hormones? It's how do I give my cells what they're crying out for? And they're going to start talking to each other in a much more respectful way. So that's kind of how I look at things like that. But yeah, B vitamins are super important, but I don't think that we should be supplementing specific synthetic B vitamins unless we absolutely need them and unless we're absolutely getting enough B vitamins from our diet first. It should always be nutrition first, supplementation last, because supplementation, sometimes taking a concentrated source of B vitamins, for example, let's use vitamin B3, niacinamide or niacin. When we take niacin, and we don't have enough carbohydrates. We're not eating enough carbohydrates. We aren't eating enough food to fuel every single cell in our body. What happens is that niacinamide is like you putting your foot on the gas pedal and having zero fuel in the tank. And so what you're actually doing is you're causing your body to have to eat itself in order to continue to survive. We don't want to do that. So we first want to balance our blood sugar, be getting B vitamins from things like maybe bee pollen if we can tolerate it, and grass-fed beef liver and things like that. And then once our metabolism is much more stable, we've been eating frequently, we've been balancing our blood sugar, our body's in a much more stable place, we can handle putting our foot on the gas pedal a little. We might even want to put our foot on the gas pedal a little. But until we're to a more balanced place, it's probably a good idea to take it in nature's intended package and not cause more imbalances. Can we run a test for Lyme disease through IGNX as a client of yours? Yeah, it's possible. I don't really do like a lot of specialty testing anymore, just because I have a very like set route. When it comes to Lyme disease, it's kind of one of those things where it's like, okay, you have it. What are we going to do about it? Oh, same thing. Okay, got it. So yeah, you can definitely do that. But I personally, I personally prefer you to have just that positive diagnosis already. And what we do is we focus on bolstering the body. We focus on getting the body strong enough. I hope if you don't already follow Mitigate Stress 2.0, Nathan, I think, had Lyme's disease. And so, he uses very similar strategies to me. And Lyme disease is one of those things, like, just like Epstein-Barr, it's being blown, like, way out of proportion, in the sense of, like, if we had a strong enough body to handle it, we probably would be fine. But when our body's already, like, at a low functioning place, it's having a very difficult time dealing with what's going on. And so it's really not about that. It's about getting our body back to optimal health so that we can handle something like Lyme's or like EBV much better. Oh, wow, did not know about the boron. Should I retest before booking with you? Yeah, that's fine. You can definitely book with me. My HTMA intake includes an HTMA, so you can retest, or we can just assume, magnesium supplementation is always important regardless of our boron levels, and usually if somebody comes to me with like a non-applicable boron level, I'll just recommend that you do it at a retest. No need to like retest just for boron, but usually people's boron levels are at some loss, but it's not something that I usually supplement with first anyways. You can get boron from raisins, you can get boron from doing like some boron foot baths, so there are other options. But I wouldn't worry about retesting until you actually do your retest, because minerals really do need to be tested every like 3 to 6 months. When I took the activated charcoal powder, I felt kind of nauseous and yuck the next day. Is that normal? It can be, because what it's doing is it's binding to endotoxins, and these toxins are really gnarly. They are not necessarily great for us, and so that's why we want them out. But sometimes what I'll do is, when I first was going through all of my shifts, I felt really awful. I had very bad digestive issues, like severe. And I would do a dose almost every day. Like if I was feeling a very nauseous feeling the day after I took it, I would probably take it again to help bind to whatever was the problem. But yeah, it definitely can happen. That is possible. What causes zits in the neck? Anything that I would say would be like guess or speculation, but usually any type of acne like right here and like on our neck is hormonal. It tends to be hormone driven, is the observations I've made, usually like estrogen or poor detoxification, even like going up into like the scalp area, or like up here like around the face. I'm going to get multiple opinions on removing my wisdom teeth, since my dentist just wants to do it for future preventative measures. Do you have any thoughts on the necessity of typical removal? I wish I would have known. There's a person that I follow. It's Blodgett Dental, Blodgett Dental, and he talks all about like holistic, like how root canals can be so damaging, and how wisdom teeth removal can be so damaging and create more problems. So I wish I would have found, I got my wisdom teeth removed when I was a teenager, but now I wish I would have known what I know, because when I was really sick and I had a lot of issues, I remember clearly having like a lot of inflammation in this area, my wisdom teeth area hurting a lot, and I wonder if my underlying like bacterial issues was being driven by my wisdom teeth. Now I haven't ever felt them hurt in years or anything like that after I started coconut oil pulling, but yeah, I probably wouldn't do it again unless it was really going to affect my teeth. Alcohol cravings have totally disappeared since I started following all your advice. The thought kind of repulses me now. Where do these cravings stem from? Alcohol increases dopamine, and dopamine is that neurotransmitter that helps balance out serotonin. Oftentimes when we have estrogen issues, or we have gut issues, or we're simply not eating enough carbohydrates, our serotonin is high and our dopamine is low, and so alcohol can give you that temporary hit of dopamine and kind of make you feel really good. That's why you crave it when you're stressed out. It's why you crave it when you're maybe like tired or not feeling great about yourself. It's because it kind of makes you feel like good, just like eating a whole chocolate cake in one sitting. So when you start to balance things out and you start to naturally increase your levels of dopamine, oftentimes those cravings go away. And this might be an unpopular opinion, but I do think people that are addicted to alcohol, that is a contributing factor in some way. I have kind of a theory. You speak very quickly. Yeah, I know, I'm sorry. I'm trying to get through as many questions as possible. My Dutch test shows that my estrogen is going down the healthier pathway, but still estrogen dominant methylation nutrients. Yeah, I focus more on the pie chart as a whole. That's going to be phase 1. And then I look at methylation, which is phase 2. And so I'm looking at each one like individually and then the body as a whole. And then also in relationship to progesterone. If we have normal levels of estrogen, but our progesterone is low, it doesn't matter. We have no progesterone to balance estrogen out, and so therefore we are estrogen dominant in the sense of we have estrogen dominating progesterone during the second half of the cycle. Remember, guys, I'll put my hydro flask. When we ovulate, our progesterone is supposed to spike up higher than our estrogen, but oftentimes when we're having a problem ovulating well or making any progesterone at all, ovulating at all, we have this estrogen that's spiked and we have no progesterone to balance it out. And so during our luteal phase, instead of having progesterone as that dominant hormone, we have estrogen as the dominant hormone, which is, we don't want this hormone of growth. Like, no, we want progesterone dominating. And so that's usually the problem. Is it's not necessarily that we are like high in estrogen, it's that we have no progesterone to mobilize it properly or balance out the effects of it. Have you ever heard of using acetyl L-carnitine for hypothalamic amenorrhea? Personally, no. I'm not a huge fan of certain like individualized amino acids, carnitine being one of them, because it can speed up the metabolism, and that's already a problem, right? We've lost our period most likely because we're not eating enough, we're not eating enough carbs, we're not eating enough calories, we're not nourishing ourselves. Possibly, that's a possible factor. And so I don't want to do anything that speeds up the metabolism if the metabolism's already struggling to get enough fuel. It's like pushing the pedal and not having enough gas in the tank. I use that analogy a lot, but it's literally what's happening. And remember, if we don't have enough gas in the tank, what does our car do? Oh, it eats itself. Yummy. I had a few hair on my chin, but after hair removal laser, it turned into a beard almost. Now I have hair on my chin, jawline, and neck. I'm lean PCOS with normal insulin and high testosterone. Should I continue? I'm not your doctor, so I don't know what the best option is for you. I think that's a personal choice when it comes to laser hair removal. Brand of non-PUFA sunscreen. Oh, you gotta check out the Skincare Edit. The Skincare Edit is a website that she's all PUFA-free skincare, and she's rocking. She has so many testimonials. Like she tries out different skincare and she rates it on like PUFA levels. So she has a lot of like non-PUFA sunscreens and then low PUFA sunscreens. So she says like if PUFA is lower than the 5th ingredient, that's considered a low PUFA because it's probably trace amounts. So I've been using Skintegrity, which is one of her low PUFAs. I think it has like pomegranate seed oil as the last ingredient, but it's mostly hyaluronic acid and aloe vera and then zinc oxide and titanium oxide, and I really like it, but I kind of want to try a tinted one because it does kind of turn my face kind of white, so, or just like it gives you that kind of like weird cast. So I want to try something else, but she has some tinted brand recommendations as well. So I definitely recommend checking her out. She has some awesome like reviews for products. What is the mineral loss pattern before vitamin D happens? Good question. So it is a cascade of loss. So what happens is our calcium goes up and our magnesium drops. It's really, vitamin D deficiency is honestly a magnesium deficiency most of the time. But then there's also a potassium loss, which is pretty common. And then we start to get smaller losses, like trace mineral losses. Like boron loss happens for sure, because, you need boron to retain magnesium within the cell. Lithium loss can occur. And I'm trying to think of the other one. It's calcium raises, magnesium loss, potassium loss, boron loss, lithium loss. There's one other one that I'm forgetting off the top of my head, and that's the cascade to vitamin D. So vitamin D deficiency usually boils down to calcification and magnesium loss. Matt Blackburn talks a lot about calcification, and I haven't talked about it a lot here, but it's really just, we are being calcified by the water we're drinking, and a magnesium deficiency. Calcium is that hormone or that mineral that's kind of sharp, and it's kind of like is that statue mineral, and so it causes contraction of muscles, and it can store up in the tissues, and it's kind of hard. And so magnesium is the opposite. It's the relaxation mineral. And so calcium and magnesium need to remain in balance. If calcium goes up, oftentimes magnesium will go down. Can you comment on low acid versus high acid levels in stomach? Can you have low acid and seem to have burping and acid reflux? Yeah, that's usually what causes it. What happens is when our stomach acid is low, we can't digest our food properly, and sometimes even like the esophageal, there's a little like I guess we can call it a valve or a sphincter that prevents the acid from getting up into our esophagus gets weak. And what begins to happen is then acid reflux, or the stomach acid mixed with the food starts to get up in the esophagus and give you that kind of burning. So that can happen from low stomach acid, that can happen from protein deficiency, which low stomach acid will cause protein deficiency, and then that can be caused also by stress. Think about if we're eating our tissues constantly, if we're constantly inducing that stress response, we're not eating enough carbohydrates, we're not eating enough fuel, so what begins to happen is our body has to compensate and make its own, and the way that it does that is by raising cortisol, raising adrenaline to eat our muscle tissue and other tissues, send them to the liver, and make sugar out of them. And so that can also be a factor, but I would say usually acid reflux is mostly caused by low stomach acid. What are your thoughts on taking N-acetylcysteine? My doctor wants me to take this to support my metabolism. I have PCOS and Hashimoto's. I think you should listen to your doctor and do your own research. NAC is like a biofilm breaker. It can break down biofilms. It's also a precursor to glutathione in the liver. Many times NAC is synthetic, but you can find it in things like milk thistle and dandelion and things like that. That's why those things are so supportive of the liver. It's because they're precursors to NAC, which is a precursor to glutathione. So personally, I can't answer if you should take something or not. That's really like you and your doctor's decision, but I can just educate you on what it is. Is there a max of HCl before it becomes dangerous? I take 4 at each meal for the past 3 months and still feel nothing. Personally, I performed the HCl challenge on myself without knowing anything, and I got up to one time 13 pills. That was years ago. I kind of, I would stop at a certain threshold. I personally would stop at 8 if it were me. But yeah, if we don't experience any any type of burning, it kind of just can take time, because remember, we need protein to make stomach acid, and we need stomach acid to digest protein. And so if we're not digesting protein, we can't make stomach acid. And if we are not eating protein, we can't make it. So we kind of have to work with that vicious cycle that we have. And sometimes consistency is the name of the game. The longer that we're working to break down protein, the more HCl we will create, and therefore eventually we will start to make more HCl and eventually will experience the burning. But it can take some time, that's for sure, especially if we've had low stomach acid forever. If iron is bad and we are overloaded, why do so many sites say that iron is needed for proper hair growth? That is the question. It's kind of one of those things where I say some things in health and wellness industry are like a sick game of telephone. It's like, we need iron for hair growth. And it's like, we need iron for hair growth. And iron is essential nutrient for hair growth. Yeah, so is magnesium, so is potassium, so is sodium, so is calcium, so is protein, so are carbohydrates. I could go on and on and on, but for some reason it's they obsess about this one thing, and that's you've probably noticed that with for example, vitamin D has become the all the rage. And calcium used to be all the rage, and it's kind of one of those things that just becomes all the rage. And so personally, estrogen drives hair loss, mineral deficiencies can drive hair loss, protein deficiency can cause hair loss, hypothyroidism can cause hair loss, stress can cause hair loss. The last thing that I would work on is iron. I would definitely focus on getting iron-rich food sources like grass-fed beef liver and lots of grass-fed beef and bison and lamb, all wonderful sources of iron because they're combined with the cofactors needed to utilize that iron, things like zinc and copper, and taking, enjoying a lot of vitamin C rich foods that also help with iron. So those are all things to kind of think about. It's not just about one specific nutrient. We need to focus on a plethora and usually getting them in the way that nature has delivered them to us. Are you going to expand on progesterone dosing in new FN? So confused on board to dose oil. I will maybe offer some guidelines. It's really not my job. It's your doctor's job, and it's your job to do research. What I would recommend is following the instructions. Many progesterone websites like Progesti and ONA's have incredible instructions. They literally spell it all out for you. I know on Long Natura Health, on the Progesti portion of it, they have all these all these instructions and all these tips and things like that. So yeah, I could possibly offer some guidelines to ask your doctor about, but I can't personally tell you how to take it. You have to kind of do your own research and figure out what's best for your body. Got my raw dairy milk today. Thank you so much. My tummy loved. Yay! Favorite blue blocking glasses? Thanks. I use these during the day, which are the JS Vision ones, a J plus S Vision, and you can get them on Amazon. They're kind of like, they are not super amber tinted, but because like I'm doing design things and I'm, looking at colors and things like that, so I don't want them to be too amber tinted. But then at night, I switch to my really amber tinted blue blocks with an X glasses, and those really are very, very helpful. They're a little bit more expensive, but they really do help me sleep. Thoughts on oil cleansing for cystic acne? I've oil cleansed for like 6 years. I think it's so great because oil breaks down oil, science. So I like oil cleansing personally, and I've used it for years for me. Like when people are like, oh, I wash my face with cleanser, I'm like, oh, I forgot that was a thing, I've always used oil for a long time. I'm lean PCOS with normal insulin and high testo. I have a few chin hair and went off for hair. I already answered that question. I said I can't tell you what to do. You kind of have to know what's right for you and trust your intuition. How do you feel about low-dose testosterone treatment for women after checking labs? Just remember, a body under stress can aromatize testosterone into estrogen as much as a body under stress can aromatize estrogen to testosterone. This is why, men who take steroids lose their hair and get really bad cystic acne because they are, turning in that stuff into estrogen pretty regularly unless they're on aromatase inhibitors. So I think it can be okay in the right setting, but also always asking, why is my testosterone low? It's usually stress related, we're not eating properly, we're not nourishing properly, there's a missing factor. And are your temps optimal? Are your pulses optimal? There's usually a missing factor involved when it comes to low testosterone. And pine pollen is an amazing way to get testosterone up naturally without doing any type, having the possibility of turning into estrogen. It's a little pricey, but it's a really good supplement. I like Crucial 4's brand. There's different types, there's like tinctures and powders, so I would do some research on that. What to look for with beef liver capsules, freeze-dried? Yeah, you want to look for like New Zealand beef or grass-fed beef. I really like Ancestral Supplements brand. It's my favorite brand. Everyone seems to do really well on it. There are other brands like Perfect or Vital Proteins or things like that, but I see that various people react differently to those ones, whereas like everyone seems to react great to the Ancestral Supplements brand, even though it's a little pricier, which makes me think that it's a lot higher quality. I'm sorry if you went over this already. What are some symptoms and treatment options for iron toxicity? When it comes to iron toxicity, it's one of those things. Melasma, I would say, is one of the more visible signs. If you've seen people with melasma or age spots, what's happening oftentimes is something called lipofuscin, and it's the combination of having polyunsaturated fats in our tissues and iron. And when iron and polyunsaturated fats react with one another, they cause something called lipofuscin, and it's oxidation of those polyunsaturated fats. It's very inflammatory, but you see it visibly with age spots or like really hardcore freckling or reacting to the sun very poorly or melasma. And so oftentimes, estrogen can make those things worse, but it's iron and PUFAs mixing together to cause something called lipofuscin. So that's just one factor, but not being able to make enough progesterone or other hormones can be a symptom. What else can be a symptom? Thyroid hypothyroidism or thyroid issues can be a symptom. Just inflammation that can't be explained can be a symptom. Having constant bacterial infections or like virus issues like EBV or Lyme's can be a symptom, just because remember, bacteria feeds iron feeds pathogens, The list kind of goes on and on. Having a liver that's really burdened, acne can be a big sign of iron issues, because remember, iron feeds pathogens, and so we have bacteria naturally on our skin, but if iron can't come out of the liver, the kidneys, and it comes out of the face, that iron is going to feed bacteria, and then therefore we're going to get acne. So that is a factor to kind of consider. So those are kind of things I would look for, but the list is very, very long. What magnesium supplement brand do you recommend? Depends on the person. I like magnesium glycinate as a form, magnesium malate as a form. I think magnesium bicarbonate is one of the most absorbable forms, but something to keep in mind is magnesium bicarbonate can neutralize stomach acid. So although very powerful, because bicarbonate is so important for the pancreas, and the pancreas creating things like having proper insulin sensitivity and creating things like digestive enzymes, it's also, we don't want to be neutralizing stomach acid that's already pretty neutral, that needs to be built up. And when we're under stress, our stomach acid really suffers, and therefore our our digestion really suffers. So we have to really do bicarbonate correctly. I also like magnesium chloride, which is usually in a spray form, like, magnesium oil or magnesium gel. Topically is wonderful, or doing magnesium flakes in a bath. That's also a wonderful way to get magnesium chloride. So I would say my favorite forms are glycinate, malate for supplement form, and then like magnesium chloride topically, and bicarbonate as like a liquid homemade form. Phase 2 liver is slower. Told choline can help. PEMT gene mutation, lower choline. Yeah, gene mutations to me are kind of bogus in my opinion. This is like an unpopular opinion as well, but okay, so there's either two phases of thought. We've either had gene mutations our whole existence, and why are they so bad all of a sudden? It's probably our lifestyle, probably a lack of nutrients. Remember, for people that test genes, they always say 80% lifestyle, 20% genes, but then they're super obsessed with the genes. And I'm like, well, genes are expressed based on our environment. That's what epigenetics means. And so if we have a gene that affects a certain thing, it's going to still be expressed by the nutrients involved, by our lifestyle, by our amounts of stress, by our thyroid hormones, all those things. So in my opinion, genes should not be obsessed about. I feel like a lot of people are like, this OMT gene, so I, can't detox this. And I'm like, yeah, you can. It's just there's something causing the expression of that gene that needs to be addressed. So I personally don't obsess with genes. I think it's really like kind of a rabbit hole, and people get stuck down it for years and years and years with no success. When it comes to phase 2 detoxification, it's all about the amino acids. So amino acids, glutamine, glycine, creatine can help, and taurine can also help, but yeah, it's mostly leucine as well. So leucine, glycine, glutamine, I'm missing one, I'll think of it. And so a lot of people are eating tons of muscle meats, and they are not eating they're eating very little amounts of gelatinous foods. Gelatin, collagen, oxtail broth, chicken feet broth, any type of gelatinous food should be our priority when we have phase 2 detoxification issues. If we are not getting enough protein from the right sources, the right types of amino acids, we are going to struggle for life with estrogen detoxification. So amino acids are one of the most important things for phase 2 detox and shouldn't be overlooked. And then carbs, glycogen, stored glucose in the liver is so important, and that's another overlooked factor. Vitamin E is also so supportive to the liver, as is vitamin C. Now, whole foods vitamin C. None of this liposomal crap. None of this ascorbic acid crap. Whole foods vitamin C. Because it contains copper, which is excellent for the liver. So I always look at food as medicine first, and then maybe individual nutrients like choline. I mean, I personally have never supplemented it with it, nor would I ever use it with a client, but that's just something to think about, in regards to nutrients are so important. Safe, optimal to take beef liver capsules daily if consuming 2 to 4 ounces of beef liver weekly. I've heard too much liver can negatively affect the thyroid. Yeah, it can. Why? Because it's iron rich. So that's something to remember. Like, a lot of people will say it negatively affects the thyroid, but they don't say why. And it's because it does have a lot of iron in it. It has copper and zinc, which help utilize iron, but at some point it could be possibly anti-thyroid. So I wouldn't do it excessively. Too much of a good thing is almost always a bad thing. So yeah, it is possible to take too much for sure. I would say fresh liver once or twice a week is plenty, and if we are doing that, we probably don't need to be supplementing. Advice for low DHEAS. DHEAS is just sulfated DHEA. It's almost kind of like, we can think of it in simplified terms, like kind of a storage form of DHEA. DHEA is a precursor to estrogen and testosterone. So if we are, if our body is using all of our DHEA to convert it into estrogen and testosterone, we're not going to really have a lot left to sulfate. And so I would look at my estrogen and testosterone levels. I would look at progesterone. I would look at pregnenolone. I would look at hormones as a whole rather than just focusing on something like DHEAS. There's a reason why it's low, and that's something to kind of look at. Thoughts on systemic enzymes. I like systemic enzymes. They can be really helpful for a lot of different inflammatory issues. Are they necessary? Not all the time, but they can be very anti-inflammatory. Is high DHEAS and high androstenedione also an estrogen issue then? I think high DHEAS is more of a sulfation problem. So we're sulfating DHEA. That can happen in the gut. It mostly happens in the gut. So it can often be a gut issue or a digestion issue. So that's usually what I focus on in regards to high DHEAS. And then I also focus on like why the body's maybe pushing. Because remember, all of our sex hormones are made from cholesterol, and then cholesterol turns into pregnenolone, and then pregnenolone turns into DHEA, cortisol, and progesterone. And then that DHEA will turn into testosterone and estrogen, but it can also, DHEA can sulfate. And that's really, that's what's happening. So that sulfation can happen mostly in the gut, but it can, I really don't stress about that so much as like a stress about the person as a whole, like what's going on. Because if we start to really like hyper focus on like, why is my androstenedione high or why is my DHEAS high? We kind of get off course. Like it's like, what's my stress level like as a whole? What's my temp and pulse? What is my what is my thyroid function, my metabolic function? Where are my stress levels? How much sun am I getting? Am I eating carbs and protein every 3 hours to keep my blood sugar balanced? Is my liver full of sugar? Am I, over exercising? Am I pushing my body too hard? We forget to look at those factors because we're just like, oh, I gotta get my DHEAS down. And there can be so many different reasons why that's high. And so we should really focus on the person as a whole and stress as a whole. Any mineral supplement you recommend to add to water in combination with mineral-rich foods? I like Edon, like electrolytes. I mean, like a trace mineral supplement is helpful for a lot of people, especially people who are active. But something as simple as just adding like sea salt and making sure we're drinking enough coconut water can be very powerful. So I think we can get minerals from food for the most part, unless we are super deficient in something and we need to actively work to get our levels up. But yeah, that's just... And Instagram's going to cut me off in like 3 minutes. So if I go off, I'll go live again for another like 30 minutes. I just don't want to lose this live. I want to be able to save it. Hi, Jessica. What are your thoughts on N-acetylcysteine? I already answered that question. So brilliantly said about androgens. So glad. What would you think the cause of severe dry eye would be? I'm having estrogen dominance and progesterone as tank. Primrose oil helps, but I know it's PUFA. Thank you. What about vitamin E? Often people who have been on like PUFAs for a long time or are detoxing estrogen, they're depleted in vitamin E, so that's a factor in a lot of people's issues. So that's something I would maybe look into. Best way to get our daily potassium in. I don't like coconut water. Minimal amount to feed the cells. We need 5,000 milligrams a day, which is a lot. So I say pretty much start liking coconut water. Honestly, that's the best source, and it's just the thing where like I personally didn't like coconut water. Most of my clients don't like coconut water, but the weirdest thing happens is when you don't like certain foods and you consume them anyways, you begin to crave them. It's almost like your body knows that it needs them. And so I personally think that coconut water can be an amazing source, but so can like OJ and potatoes and stuff like that. But coconut water is just such a concentrated source. Whenever I consume tea with milk, I get acne and oily skin. Don't you think this dairy, which comes from cows that are treated with high estrogen, is dangerous for us? I highly recommend watching my story highlights on dairy. I have one labeled Dairy 1 and Dairy 2. I have multiple posts on dairy. Hopefully that will help you kind of understand that cows' livers detoxify many of the hormones that before they even get into the milk. So it's something to remember. Like, there's a purpose for that milk. It's being fed to babies, to children. If high amounts of estrogen and progesterone were getting into the milk, that would be damaging for not just us, but also these cows and humans too. We make milk too. They're our children. So we kind of have to think of it that way. It's being blown way out of proportion. Sorry, what I meant was if 5A pathway preferred, is it possible that taking progesterone would move more towards androgenic pathway? Androstenedione levels very elevated, aromatized estrogen. Possibly, I've seen people who aren't ready for progesterone get put on progesterone or take progesterone, and they start dumping all this estrogen from their tissues, and it causes more problems than good because that estrogen's not getting out of the body properly. There's constipation, maybe phase 2 detoxification is really sluggish, and so you have this trap door in between phase 1 and phase 2 detoxification, and if you have too much estrogen, it's kind of like a bottleneck effect, and what happens is estrogen will go through this trap door in the liver, that's a simplified version, trap door, and go back into circulation and cause estrogen dominance. So that is a possibility. Like if we are not ready, if our liver's not ready for the estrogen detox, or we're not eating enough carbs, or our gut's not ready, if we start doing something that's going to mobilize estrogen and we can't handle that estrogen, of course, the issues being driven by estrogen are going to cause more problems. I hope that makes sense. So I appreciate your speedy delivery of beautiful information. Thank you. I know I talk fast, but it's like people have told me multiple times, like, thank you for talking fast. So I try to like keep it speedy. Doctor suggested low dose aspirin during my pregnancy. Don't you do this too? How, when to take safe? If doctor recommended it, because, you know, they use it very commonly during IVF treatment. They use it very commonly during trying to conceive. It's very popular for conception and for people that have a hard time conceiving. And so if doctor's recommending it, I personally would listen to my doctor. That's actually a very forward way of thinking, personally, I think. All right, guys, Instagram's going to cut me off. I'm going to go live again. Stay tuned.